the project of leasing specialized medical equipment by county governments stopped to allow for consultations and equipping of health facilities with trained personnel, water and electricity. Health Cabinet Secretary Sicily Kariuki told the Senate that 97% of specialized medical equipment in counties was underutilized due to human resource challenges and lack of electricity. At the same time, the Senate has expressed concern that lack of proper consultation between the two levels of government has resulted in variation of lease agreement from the initial cost of 38 billion shillings to a whopping 63 billion. Our Patrick Amimo begins our broadcast tonight.
In February 2015, the Ministry of Health awarded leasing agreements for the provision of specialized medical equipment to counties worth 38 billion shillings. The project was implemented in all the 47 counties, with 2 hospitals in each county receiving equipment, in addition to 4 national referral hospitals. The equipment to be supplied by private sector service providers included theatre equipment, sterilizing equipment complete with surgical sets for all operations, laboratory equipment, renal and dialysis equipment, ICU equipment and radiology equipment.
Really, for me, is a raw deal because there was issues with human resource capacity and the identification and the need of the kind of equipment at the moment.
We have even given more input of what we want.
The Senate grilled Health Cabinet Secretary over the project after several accountability and transparency issues were raised by counties. Counties complained that their budget ceilings had been adversely affected when the national government compelled them to pay 95 million shillings per annum each for the project. The figure has since been revised to 200 million shillings.
The cost is being shouldered at the national government level.
Primary allocatee is the county. Whether you hold the money here or not, when you go further with that figure of 9.4 billion this year, 200 million is allocated, apportioned to every county. To that extent, then, the money is allocated to the counties in the name of the counties.
That is what we passed in this House.
Senators heard that majority of the specialist medical equipment was lying idle in health facilities in the counties, despite millions of taxpayers' money having been paid to leasing companies.
Equipments under use and operational are in the range of 97% of all the health facilities.
Isn't it an act of gross negligence for the ministry and the national government to supply equipment to units they know have no personnel, have no water, have no electricity? And what is the equipment for?
The ministers who are there when the contract was initiated, they are still serving this country.
No equipment or any other asset should be bought on behalf of the county government unless it is agreed and understood by everyone.
Counties that have not received the equipment, or rather those that have received and they are not in use, we must come up with a solution that these deductions must stop.
The senators also expressed concern over the high charges for the specialized services.
I find it extremely irreconcilable, for instance, that you should lease a trolley.
This was done deliberately, Mr. Chairman, to embezzle funds from our counties.
The CS was stood down and asked to furnish senators with a detailed report on the leasing contract of specialized medical equipment, which has caused an uproar among governors.
Yes, you on 25.
Patrick Amimo, KTN News.
Senate